Greetings everyone. Welcome to my YouTube channel. Today I'll be conducting a revision session of the most important topics of general toxicology. Let's start with the definition of toxicology. So, toxicology is the branch of medicine which deals with the properties, action, lethal dose, detection or estimation, signs and symptoms, diagnosis, treatment, and autopsy findings of poisoning cases. Although the definition might seem quite lengthy, it is easy to remember if you follow the logical sequence of a poison, such as discussing the properties of a poison, then going into the action of the poison, the lethal dose of the poison, detection of the poison, estimation of the poison, that is, how much of the poison is present in the body, signs symptoms produced by the poison, diagnosis of the poison through its signs symptoms, of course, treatment of the specific poisoning, and autopsy findings of poisoning cases. Forensic toxicology is a more specific definition which deals with medical and legal aspects of harmful effects of poison on the human body. So, what is a poison? Poison is basically any substance which may be solid, liquid, or gaseous, which, when introduced into the body through any route, produces ill health, disease, or death by its local or remote effects, or both local and remote effects. So it's not necessarily that a poison will always produce death. If it just produces ill health, it is enough to be called a poison. A few other definitions which are nice to know. Poisonous is any substance which contains a poison, and poisoning is introduction of poison into a living body. Think of poisoning as this image here, where you introduce a poison into a living body. Coming to the medical legal classification of poison, which is the most important classification of poison, at least from point of view of forensic medicine, because through this classification, it is easy to find the motive of a specific poisoning case. For example, if you do an autopsy of a person and you find datura in the stomach, you can most likely conclude that the person has been given datura in order to stupefy him, in order to carry out a crime. Hence, we have the medical legal classification, so it is easy, or easier rather, to predict what will be the cause or motive behind the poisoning. Similarly, if you find a recently pregnant woman who has died due to abortion, illegal abortion, you might find substances such as plumbago, calotropis, lead on her uterus, and you can give a most likely opinion that she has died due to an illegal abortion. So, what are the classic medical legal classification? It is homicidal, suicidal, accidental, stupefying agents, abortifacients, infanticidal, cattle poison, arrow poison, aphrodisiacs, and rare poisons. Coming to classification of poison based on mode of action, it is broadly classified into four: corrosive poisons, irritant poisons, systemic poisons, and miscellaneous poisons. Why are we learning this? It is because knowing the classification based on the mode of action or the chief symptom produced helps us to predict what effects it will produce on the body. As you know, corrosives such as strong acids will cause corrosion of any part of the body which comes in its contact. So let's get into the classification. Corrosive poisons are classified under strong acids, strong alkalis, and metallic salts. Irritants are classified under organic irritants, inorganic irritants. Inorganic irritants are further classified under metallic irritants, non-metallic irritants, and mechanical irritants. Organic irritants are further classified into vegetable, and animal irritants. Coming to systemic poisons, they include cerebral poisons, which are further classified into CNS or central nervous system depressant poisons and central nervous system stimulants, and also deliriants. Other systemic poison is the spinal poisons such as nux vomica and gelsemium, peripheral poisons such as curare, cardiac poisons, these affect the heart. Tobacco, quinine, and aconite are well known examples. Asphyxiants are ones which cause asphyxia, as you know, carbon monoxide poisoning. And miscellaneous poisonings are for example, poisons caused by food poisoning and botulism, which cannot be classified under any of the above three categories. So now think of yourself as someone who wants to produce a poison. So what would you want this poison to be like? You would want it to be highly toxic. You would want no antidotes to be present. You would want that the sign symptoms should resemble a natural disease, so there is no doubt or suspicion. You would want it to be colorless, odorless, and tasteless, and you would want it to be easily administrable with food and drink. You would want such a poison that is rapidly metabolized in the body, so it cannot be detected by tests and there are no postmortem changes. The closest to ideal homicidal poison are thallium and fluorine, but commonly used homicidal poisons are arsenic and aconite. To the criteria of ideal suicidal poison, a person who wants to do this act would want it to be highly toxic, produce a painless death. Death should be certain, must be tasteless or have a pleasant taste, and it can be easily taken with food and drink. Opium and barbiturates, and commonly used in rural areas are organophosphorus compounds, and in urban areas, barbiturates. Common accidental poisons. Since our country, Bangladesh, is a rural country, there is greater access to insecticides such as organophosphorus compounds. So it is one of the so organophosphorus compound is one of the common accidental poison in Bangladesh. Snake venom, it's self-explanatory because snake bite is accidental and snake venom is hence an accidental poison that is quite common. Kerosene oil, as it's commonly used in homes for lighting purpose, especially in rural areas where there is no electricity. And most common victims are crawling children because they suck on the wick of the kerosene lamp. Arsenic, which is a rat poison and quite commonly found. Opium, especially in addicts who might accidentally overdose. Sulfuric acid, nitric acid, carbolic, and oxalic acid. Sulfuric and nitric acid are common industrial chemicals. Carbolic and oxalic acid are common household. Now coming to action of poison, depending on the location of its action and also how they produce their toxic effects, poisons can be having three specific types of action. They are local action, remote action, and combined action. Examples of local actions include chemical destruction by corrosives, inflammation by irritants, dilation of pupils by datura or belladonna, remote actions, for example, the actions which are produced by cantharides, nux vomica, opium, and barbiturates. Many of these are, or all of these are ingestible poisons, and they don't necessarily produce their effects on the gastrointestinal tract. Rather, they produce their effects after being absorbed in the bloodstream and producing their effects in distant areas. Combined action of poison implies that there is both local and remote action. For example, with let's say heavy metals like arsenic, you will have both local irritation and also you will have the systemic effects of the poison after it gets absorbed into the bloodstream. A better example is snake venom. It causes local irritation, but also upon entering the bloodstream, it may cause cardiotoxic or myotoxic effects. Now coming to rapidity of action of poison. Basically, based on the route, we can predict how rapidly a poison will act. So the most rapid way a poison will act is if it is inhaled, followed by intravenous injection of the poison, followed by intramuscular, intradermal injection of the poison, application of the poison into the wound, application of the poison on a serous surface, application of the poison on the tracheobronchial mucosa, ingestion of the poison or absorption from the stomach, application of the poison on natural orifices, and finally, the slowest way a poison can act is if it is applied on an unbroken skin. First dose of the poison, First dose of the poison, greater the dose, greater the toxic effects, except for copper sulfate and alcohol, as more doses of them cause vomiting. Form of the poison, physical state, gases and vapors act more rapidly than liquids. Chemical combination, the solubility may decrease due to chemical combination. Mechanical combination, again, the action of the poison might decrease due to it being combined with an inert substance. Mode of administration, as we know, inhaled route is the most rapid route for action of poison, and application to unbroken skin is the slowest route. Condition of the patient, age, extremes of age are more affected by poisons. Health, a healthy person tolerates poison better. Sleep, the action of poison is delayed in a person who takes poison and goes to sleep. Similarly, intoxication, the action of the poison is slower in an intoxicated person. Idiosyncrasy, some people may be more sensitive to a poison as compared to others. Thus, its effects will be more in that person. Habit, tolerance develops in addicts, so greater amount of poison will be required to cause the toxic effect. Cumulative action, if the elimination of the poison is slow, then small amounts may accumulate over a period of time, causing the toxic effects. Stomach, empty stomach absorbs poison rapidly, and food delays the action of poison, as the poison is mixed with the food. Toxic dose is one that produces serious toxic effect. Lethal dose or fatal dose is the minimum amount of substance that causes death in 100% of the experimenting animal. Fatal period is the time taken by a poison to cause death from the time of administration. Suppose you're a medical officer and someone has come to you with a history of poisoning. So, what are the symptoms that you will look out for which can predict? So, what are the symptoms that you will look out for which are suggestive or which are in line that suppose you are a, suppose you are a medical officer and you have a history. Suppose you are a medical officer and you have a patient who has a history of poisoning. Suppose you are a medical officer and a patient has come to you with a history of poisoning. So, what are the symptoms that might be in line with poisoning? So, these are sudden onset nausea, vomiting, abdominal pain, diarrhea, and collapse, sudden onset of coma with pupillary constriction, sudden onset convulsions, delirium with dilated pupils, especially with datura poison, lower motor neuron type paralysis, jaundice, oliguria with hematuria means. So, how would you suspect someone has been poisoned? You would look for the following symptoms, which is symptoms appearing suddenly in a healthy person, symptoms appear within short time after consuming food or drink. Several persons who have taken the same food have the same symptoms and they appear at about the same time, and trace of the poison will be found in food, vomit, or excretia. So, types of poisoning. As you can see, the stomach mucosa over here has been damaged. So, This can be a case of fulminant type of poisoning. This is a well-known example of chronic arsenic poisoning. So there are four types of poisoning. First is fulminant poisoning, then acute poisoning, chronic poisoning, and subacute poisoning. In fulminant poisoning, there is a massive dose of poison and death occurs rapidly, sometimes without producing signs and symptoms, and the person just collapses suddenly. Acute poisoning occurs by excessive single dose or multiple small doses taken in a short time, and the symptoms appear abruptly. In chronic poisoning, it is due to small doses over a long period of time, and the onset of symptoms is insidious or gradual. Subacute poisoning combines both acute and chronic poisoning, hence, the symptoms appear gradually over a period of days. Now, opinion when it comes to poisoning cases. Of course, immediately after an autopsy has been conducted, you will give a primary opinion, and that opinion would be along these lines. Opinion regarding cause of death is kept pending until chemical analysis report of preserved viscera is received. It means exactly what it says is that the final opinion of the cause of death is kept pending until the receipt of the chemical analysis of viscera. Final opinion is the opinion which you would give after you would receive the chemical analysis report. This opinion is given along these lines. Considering autopsy findings and chemical analysis report, I'm of the opinion that that was due to asphyxia resulting from whatever poisoning which was antemortem. The viscera which are commonly preserved is stomach with its contents, liver not less than half kilograms, a longitudinal half of each kidney. Why do we preserve these viscera? Or why we can understand that we need to preserve the stomach to keep. It is understandable that we would like to preserve the stomach to find traces of the poison, but why do we collect the liver and kidneys? Well, here is why. It's because after the poison has been absorbed, it passes through the liver and it is excreted via the kidneys in the urine. Hence, we retain the liver and the kidney along with the stomach. So, what are the preservatives which are commonly used? The preservatives are saturated solution of common salt, absolute alcohol or 99.5% alcohol, rectified spirit or 95.6% alcohol, and formal saline, 10% formal saline, and this is used more to preserve histopathological specimen. Now we have done chemical examination of your viscera, but why you have not found any specific poison? Let's consider a scenario where the chemical analysis report is negative, means that poison is not detected after chemical examination. Why would that be? It could be due to several reasons. Some of them is in front of you, such as removal of the poison due to vomiting or diarrhea, hence you would not find it in the stomach. Early disintegration and excretion of the poison, hence you wouldn't even find it in the stomach, in the other viscera, such as liver and kidney. Complete metabolism of the poison, negligible amount of poison preserved in the viscera, improper preservation of the viscera, wrong analysis technique, and delay in examination of viscera. As you know, some poisons might break down or decay, hence delay in examination of viscera might lead to a negative finding. So what are the different duties of doctors? We'll be discussing the duties of three doctors, that is the outdoor medical officer, the indoor medical officer, and the forensic medical officer. Coming to the outdoor medical officer, his responsibilities is history taking and clinical examination of the patient, decontamination of the patient by removing the contaminated clothing, and also using gastric lavage and use activated charcoal. Administration of antidote, supportive care and monitoring of the patient. Duties of the indoor medical officer is continued monitoring of the patient and providing supportive care, observation of the patient for any delayed symptoms such as respiratory depression, continuation of the antidote, management and assessment of any antidote related toxicities, laboratory investigations. This is a very common question, that what laboratory investigations would you give? This is a very common question, that what lab investigations you would give as an indoor medical officer in a poisoning case. So some examples include cholinesterase level, specifically in organophosphorus compound poisoning, serum electrolytes, liver enzymes, renal function, arterial blood gas, ECG. Other duties of the indoor medical officer includes management of complications, reporting to hospital authority, psychiatric evaluation of the patient and counseling, coordination with specialists with regards to treatment of the patient, and discharge planning of the patient and follow-up. However, unfortunately, if the patient has died, what are the duties of forensic medicine doctor? First, you have to confirm death of the patient, conduct the post-mortem examination, collection of the viscera and sending the samples for chemical analysis, determination of the cause of death, providing or creating medical legal documentation and death certificate, providing expert opinion in court. General principles of treatment of poisoning. Why do we have to know this? It's because in the treatment of any case of poisoning, we have to do the following four steps, which are removal of the victim from the source of exposure, removal of unabsorbed poison, elimination of absorbed poison, use of specific antidote, and symptomatic or supportive treatment. Now, coming to application of second principle of treatment of poisoning is the removal of unabsorbed poison, and this is done by the stomach wash procedure. It is useful within 2 hours of poison ingestion and most useful within 1 hour. You can see here are the parts of the stomach wash tube, the funnel, the rubber tube, the suction pump, the lateral openings, and this is the mouth gag. Here are the instruments which are used for stomach wash or removal of the unabsorbed poison. These are the stomach wash tube, also known as the Boas tube or Eval's tube, Ryle's tube for infants, male urinary catheter for young children. It has a length of 150 centimeters and diameter of 1.5 centimeter. With two ends, the upper end has a funnel and the lower end has two side openings. Here's the importance of mouth gag. Keeps mouth open, prevent biting of tube and tongue, prevent fallback of tongue, and easier to insert in non-cooperative patients. What's the procedure of stomach wash? Here is a picture depicting the insertion of a nasogastric tube here. Now coming to procedure of stomach wash. Here's a video link for gastric lavage. It gives a good idea about how it's done practically. And this is a video on siphon action. So this is the big wall of text. Basically, the patient must be lying on its left side or in a prone position with the head hanging over the edge of the bed. The stomach wash is inserted uh, through the mouth by lubricating with glycerin or Vaseline. Position of the stomach tube can be checked by stethoscope or putting the upper end under water and checking for bubbles. Now, initially 250 milliliters of lukewarm water at 35 degrees Celsius is passed through the funnel held high up. Why? It's because when you bring a funnel lower down into a container, the stomach contents come out automatically by siphon action. So what is the siphon action? So basically when something is placed high up, such as see the liquid level, which is much higher than this, and you connect a tube, what happens is that until the two fluid become at the same level, there will be transfer of fluid into the another container. Hence, First, you place the tube high up initially, and then you place it lower the level of the stomach into a bowl so that through the siphoning action, the contents of the stomach will empty into the bowl. Now you retain the first sample of the stomach wash for chemical analysis, and then you use half liter of the suitable solution and repeat till clear colorless fluid comes out. After completion of the stomach wash, a small quantity of the fluid is retained in the stomach so it may neutralize whatever poison is left in the stomach. Now coming to the contraindications of stomach wash. We can remember the contraindications by 4 C's. The first absolute contraindication is corrosive poisoning due to risk of perforation, except carbolic acid poisoning, because in carbolic acid poisoning, the stomach becomes hard. The related contraindications are poisons which cause convulsions, as in lead to convulsion and lead to aspiration of the poison, further complicating things. In comatose patients, because their cough reflex isn't as active as normal past person, in children and infants, and in very old persons, and also in upper alimentary diseases. What are the complications of stomach wash? They are laryngeal spasm due to insertion of the rubber tube, aspiration pneumonitis, perforation of the stomach, gastric ulceration, hematemesis, or vomiting of blood, cardiac arrhythmia, and vagal inhibition. Coming to what are antidotes? Antidotes are substances which prevent the action of the poison, neutralize the poison, or produce sign symptoms opposite to those produced by the poison. So these are some examples of antidotes. Activated charcoal, which is a physical antidote, naloxone, which is a specific physiological antidote, anti-snake serum, which is an anti-sera, and these are chelating agents or British anti-leucine. Let's see the classification in more detail. Antidotes are classified into 5 classes. They are physical antidotes, chemical antidotes, physiological antidotes, chelating agents, and serological antidotes. Examples of physical antidotes include demulcents, adsorbents, diluents, and bulky food. A very common example of adsorbent is activated charcoal. Physical antidotes act by mechanically binding with the poison and preventing its absorption. Chemical antidotes act by chemically binding with the chemical substance. Chemical antidotes work by chemically binding with the poison and preventing its toxic effects, such as weak non-carbonic alkalis, which are used in acidic poisoning. Why do we use non-carbonic alkalis? Is so that if you use carbonate alkalis, such as sodium bicarbonate, it will lead to production of carbon dioxide and that would create complications of its own. So we use non-carbonate alkalis. Physiological antidotes, they act on the opposite system. For example, neostigmine is the physiological antidote of atropine. Atropine is an anti-muscarinic agent, and neostigmine is a muscarinic agent. So you can see that their actions are the complete opposite of each other. Chelating agents such as British anti-leucide, EDTA or ethylene diamine tetraacetic acid, and penicillamines. They bind to poison through chelation. For example, this is a poison, and EDTA would bind through this way to a poison. Serological antidotes are very common, which serological antidotes are anti-snake venom. Now suppose a child has accidentally ingested antihypertensive medicines of his grandparent. What will you do now? One way is, if you have the knowledge of the universal antidote, you can save his life. How? You can create the universal antidote by mixing 2 parts of activated charcoal or burnt toast 1 part of magnesium oxide or milk of magnesia, and 1 part of tannic acid or strong tea. Burnt toast, milk of magnesia, and strong tea are common household items, and if given to such a child in case of an accidental poisoning, you could save his life. This is a slide with the specific antidotes of some poisons. You can check them out. The specific antidote of organophosphorus compound is atropine. The specific antidote of opium is naloxone. Specific antidote of datura is neostigmine, as datura is hyoscine, which is anti-muscarinic, and neostigmine is a muscarinic. Specific antidote of benzodiazepine is flumazenil. Specific antidote of benzodiazepine is flumazenil. Specific antidote of paracetamol is N-acetylcysteine. Specific antidote of iron is desferoxamine. Specific antidote of atropine is physostigmine or neostigmine. So here is a chart of fatal dose and fatal periods of some important poisons. So what are some poisons that can be detected by smell? Say you're this autopsy surgeon who have just opened the thoracic cavity and you have a pungent smell. And through identifying that smell, you can detect the following poisons. You can detect kerosene, you can detect organophosphorus compound, alcohol, and opium. Organophosphorus compound has a smell of kerosene due to the additive Aromex done with the important parts. These are less important parts. So what are demulcents? Demulcents are the substances which protect the mucosa from damage. They include milk, starch, egg whites, mineral oils, milk of magnesia. They are also used for treatment of or relief of gastric ulcers or gastritis. What are some contraindications of demulcents? In case of kerosene, carbolic acid, or organophosphorus compound poisoning, you should not use fats and oils as they are soluble in the poison and they further worsen the situation. What are ecbolics? These are drugs which cause contraction of the pregnant uterus. The natural ecbolic is oxytocin. This slide gives some don'ts in poisoning, and this would conclude today's presentation. The first don't is do not give stomach wash with a wide bore tube. Don't give gastric lavage if ingestion is more than 1 hour, except salicylates, iron, and anticholinergic poisoning. Do not give emesis. Do not give forced diuresis, except in salicylate and amphetamine poisoning. Do not give whole bowel irrigation except iron, lead, zinc, and packets of drugs. Thank you for staying with me today, and I hope that you have gained something